So good morning, good afternoon to everyone. Welcome to today's webinar on building a culture of healthcare privacy compliance. With us today are Jerry Hinckley, Greg Radinsky, and Wendy Maniveau. I now turn the call over to Jerry.
Hi, thank you, Michael. I want to welcome everybody. Sorry for our technical difficulties. It seems like whenever we're talking about something technology related, this happens. So I think we got through it. Can we go to the next slide, Michael? Just a reminder that this is not legal advice. This is just our giving our own comments and thoughts on developments in the law. Next slide. Hi, here are our speakers. There I am in the upper left, and I'm joined by Greg Radinsky from North Shore Long Island Jewish and Wendy Maniveau from Christiania Care. Next slide. So here's what we're going to try to accomplish today. One, we want to start by giving you an understanding that the need really is to make patient information privacy and security everyone's job at an organization. Then we thought it would be useful if we could give you a couple of useful case studies about how organizations have successfully implemented cultures of privacy and security compliance. So we're going to start with Greg giving some examples of the efforts that have taken place at North Shore Long Island Jewish, and then turn it over to Wendy to share with us her insights with respect to what they've accomplished at Christiania Care. Highlights of their presentations will be to explore the education and awareness programs, the internal organizational structure, internal audit practices, and internal collaboration that's required to carry this out. And at Christiania, deep dive into some of the disciplinary structure issues that are confronted, the training, and also inter-organizational communication and collaboration. Next slide. So kind of from the very beginning, what we've learned after many years of trying to work through various approaches to privacy and security compliance is that it isn't an assignment to the IT department alone. It isn't an assignment to a privacy or security officer alone. It really has to be organizational, and in my view, it needs to start at the top. So those of us who have the opportunity to be in the boardroom, to work with directors and trustees, need to instill in them the requirements for an organizational commitment to privacy and security, because these are the same individuals who are charged with directing the overall management of the affairs of the organization, but also typically in the nonprofit setting are the leaders in fundraising. And they need to go out in the community and help tell the institution's story, and they don't like it when the story includes information or questions about a major data breach that hit the press and needs to be explained. My recommendation typically is that the chief privacy officer, and I believe there also ought to be a chief security officer in an organization, ought to have a direct reporting link to the board of directors and not be funneled through the chief financial officer or even the chief executive officer. That this is really a function of internal audit that needs to be reported to the board on a regular basis. Secondly, it needs a budget. Once a plan is determined with respect to compliance, it needs to be funded. I've recently been visiting with hospital health system risk managers and asking them where privacy and security is, in their top 10, what keeps you up at night. And I was a bit surprised to find that very few of them have privacy and security in their top 10. They're principally focused on patient safety, and even building security over information security. What I've tried to encourage them to do is to realize that this is a significant issue. It works its way through the entire organization, and needs to be well funded. And risk managers, in addition to chief privacy and security officers, need to be engaged in managing this risk and making certain that insurance coverages are in place to protect the organization in the event of a data breach. As I mentioned, you need realistic plans and you need to set priorities. All HIPAA-covered entities and their business associates need to be conducting regular risk assessments. And these need to be rolling. They need to be always ongoing, and it needs to be a continually correcting environment. And so managers in all departments really need to take responsibility for the elements of privacy and security compliance that have an impact on them. Recently, we had a situation with a hospital where records ended up in a disposal bin by mistake, and were allowed to blow down the street. And the security people, lobby people who saw this happening, it never occurred to them that they had responsibility for seeing what was on that paper and taking steps to ensure that it was recovered and secured. And staff, as I know both Greg and Wendy will touch on, need to understand that there are consequences to bad behavior, not only for intentional conduct, but also for, clearly negligent activity and failure to follow policies and procedures. That failures with respect to privacy and security compliance are as significant as major patient care events. We also need the physicians to take a role in leading by example, to encourage, in the bedside, how information is going to be shared, but also in keeping conversations at the nurses station at an appropriate level, and in carrying it out into the community so that their patients who really trust them to make the healthcare decisions for them have a sense that the physicians are also focused on protecting the privacy and security of their health information. And then finally, I think a point is that an essential element of a culture of compliance is that it is a confident culture, that it is one where the organization holds out to itself is that privacy and security is really what we are about, and that everyone top to the bottom of the organization has that sense. So kind of with that introduction, I'd like to turn it over to Greg, who's going to share his case study, and then turn it over to Wendy, and then we'll have time at the end for some Q&A. Greg?
Great. Well, thank you, Jerry, and good morning and afternoon to everybody on the call. I hope to provide you some information. I think Jerry gave it a nice kickoff about some of the things that are really important that he has identified through working through all of his clients. And clearly, privacy is a very tough issue today, and I think today's topic is more of a soft topic, right? How do you actually build a culture of compliance? And one of the things that I recall way back is when CMS did surveys and studies on what really makes an effective compliance program, they really tended to focus in on some of the soft factors as well as the hard factors. And I do think the soft factors really do make a difference with privacy. Privacy is one of the things that almost all your employees can identify with. Unlike other types of issues related to compliance, such as fraud and abuse and coding and billing issues, everybody's been a patient or has had a family member who's been a patient. So it's very easy to resonate messages with employees and staff on how to protect the patient's information. If you could just click on to the next slide. My goal today is really to be a resource, first off. If you have any questions after the presentation or want to share ideas, I'm happy to do so. There's lots of ways to do this correctly, and we can all learn from each other. So if you have any questions, please feel free to contact me afterwards if there's not enough time. What I'm trying to do today is really to give you some examples of some of the things that we've done, and maybe you think they're good ideas and work for your organization. Maybe they might be not suitable for your organization, but my goal is to kind of give you our structure and kind of how we've gone about building trying to build a culture of compliance. We've been doing this for several years. I mean, I think we've really put a strong effort in over the last several years and have identified and tried to identify different things that we can continue to make the program stronger. So a program can always get stronger, and I'm going to go through some of the things that we've tried to do that. I'm going to be going through just not privacy and education awareness, but talking about our committee structures, our audit practices, and how we collaborate with other departments as well. Next slide, please. So with education and awareness, we try to view this not as a one-time-a-year exercise. For all employees and workforce members, they go through pre-employment training, and then each year we have an annual training on HIPAA. Our annual training has a heavy focus on HIPAA. I would say they get a good 40-plus minutes on HIPAA alone each year. But that's not the only training that we do. We try to send out security reminders and privacy reminders throughout the year. We have a cartoon that I'll be going over. We had an education campaign called Keep It Confidential, where all of our employees got a letter sent to their house with a pamphlet from our CEO explaining the importance of privacy and security. The nurses on their nursing rounds, we typically give training in that through that process as well. We obviously give individualized training to certain departments as needed. So there's a whole host of things that we do throughout the year. So the privacy message is just not a one-time-a-year exercise. It's employees are getting pinged at least several times throughout the year on various things that we want to emphasize. In addition to that, OCR often comes up with training examples. Some they publish, some they'll give to us informally in the past, tips on how to fax information, how to communicate with friends and family members of patients, and we try to provide those resources, incorporate all that information into our training as well to the extent that it's feasible. Next slide, please. So this is just an example of when OCR back in the end of 2012 released information on tools on how to protect patient data in mobile devices. I just use this as an example, but they do come out with guidance. They have a whole host of guidances on their website for various topics, and I found it helpful to use some of those tools as well. Some of them are very good and clear and easy to communicate with employees, and others may not be as suitable, but nonetheless, it's a great resource, and I think it's helpful to try to incorporate the regulatory's guidance to the extent you're able to. Next slide, please. This is just a sample of a screensaver. We have a few of these that go on throughout the year, and it's just an example of a way to make sure for all the employees that have access to a computer, it's right in front of their face, patient privacy, and we have found, again, the constant message of privacy compliance to be helpful. Next slide, please. As I mentioned earlier, we have a cartoon. Our compliance mascot's name is Champ. We view him to be the champion of compliance. We try to put a friendly face, so it's not a dog that growls, but a dog that always tends to be happy and comes to the rescue. And I'm not going to read through the cartoon, but we have a cartoon that goes out to all of our employees through our employee publication quarterly, and each quarter there's a cartoon, and I would say the majority of those cartoons tend to focus on HIPAA issues and then occasionally some other types of compliance issues as well, but we have a heavy focus on HIPAA lately. Next slide, please. You can go ahead and hit the next slide as well. In addition to the cartoons, we have security reminders. So HealthPort is our intranet site for all employees. It's something that's frequently accessed by employees on a regular basis each day. And as you can see, one example of that is Fair Warning, which is a online detection system that helps us figure out who's accessed information of patients in an inappropriate manner. And this was just an announcement announcing that we're watching their access to the electronic medical record. So we found these announcements to kind of be short little pings. They see them each day on a constant basis, and it resonates that they're being watched and that privacy is important, and there's consequences if they don't comply with our policies. Next slide, please. And this is just another example of we have our Keep It Confidential campaign, and we're explaining that they need to know our HIPAA policies. And if you read later on, if you could see it said read more, and you'd click on it, and there'd be a listing of our HIPAA policies if they had any questions or concerns, and our number to contact us. So these are ways that we can educate employees quickly on quick topics, and what we're really trying to resonate, because employees are busy trying to memorize 100 different things throughout the day and try to complete so many different tasks, that they just know who to contact, and that privacy is important. And we tend to feel that if they know that a simple message, such as just keep it confidential, they'll think about their work functions in a different way, hopefully, and try to take the precautions, even if they can't remember always everything in every policy. So we found that to be a helpful resource and way to bring awareness to our employees and workforce. The next slide, please. This is a copy of the front of the brochure that we sent out to our employees. As I mentioned, our CEO signed a letter saying that we have a zero tolerance for inappropriate behavior related to privacy and security. We tend to focus in on this particular brochure on identity theft, which we think is a growing issue throughout the industry. Laptops and mobile devices, which seems to be a heavy focus of OCR and tends to be the types of breaches that often are over 500 patients, and certainly encryption is a great defense for that. And then unauthorized access to protected health information, which this deals with kind of the snooping issue, which tends to be common with employees despite a lot of education. They sometimes can't control their urge to look at a family member or neighbor's information, or celebrity perhaps. And so we tend to hone in on these issues, but certainly we hone in on other issues throughout the year. We've sent out blurbs on cloud use and all sorts of other types of issues and timely issues as they come about each year. So this is just a way for us to try to reach our patients. And with our Keep It Confidential campaign, we actually, in addition to the compliance webpage on our intranet site, we have a special webpage just for the Keep It Confidential campaign as well. Next slide, please. So training is a lot of things, and for everybody that has access to our EMR, so for example, non-employed physicians who have staff privileges, anybody that hits the EHR has to sign each year a attestation that they're going to comply with confidentiality provisions, and that if they don't, that there's definitely consequences for that for them if they choose not to comply. So this is just an example of the attestation and confidentiality agreement that we have that we require our workforce to fill out each year online. And our employees also, when they come on board, sign a couple different confidentiality attestations in addition to this as well. So we're hitting up our employees with educations and attestations and reminders in a lot of different ways. So it's just not a one-time thing. It's annual, and there's several of them. So, again, I think the constant reminders of privacy we tend to feel have been helpful in resonating the message that it's just not a once or twice a year exercise. Next slide, please. We have a lot of different HIPAA-related committees as well in trying to build a culture of privacy and security compliance. So I think Jerry mentioned that board committees are important, and it does need to start at the top. So we're very fortunate our CEO sends a letter out to all of our employees stressing the importance, and we certainly bring up issues of privacy to our board and educate them on a frequent basis. I report on a quarterly basis to our Audit and Compliance Committee board, and I also report to our executive committee of our board and to our full board. So I'm giving a board report almost every other month or so, if not more frequent, to some board committee throughout my organization. We also have an executive audit and corporate compliance committee that is comprised of senior executives, and we certainly bring privacy issues to them. We report any potential breaches on a quarterly basis to all of these committees as well. In addition to that, we have an IT governance committee, and this committee really looks at EPHI risk, and we go through the various factors and issues that are identified, and we rank those risks on a regular basis and keep track of a remediation log for any issues that come up throughout the year. So this committee has been very helpful in helping identify issues and resolve them that relate to EPHI. We also have, in addition to the executive committee, a committee that's led by our corporate privacy officer. I attended as well. and legal, risk, HIM, IT, physician leadership, attends the PHI committee. And this is where we really talk about issues of general concern that relate to patient privacy. So it could be anything from implementing a new IT application that's going to impact a lot of folks and trying to figure out if we've gotten the right feedback to have all the right security controls in place and make sure that they're feasible, to going over the new rule released by the agency related to labs and privacy. So it could be a whole host of different things, but anything that comes up in the privacy world, we tend to try to discuss at that committee. And then we have a separate committee called the Patient Privacy Committee that really hones in on forms throughout the organization that are given to patients and throughout the organization to figure out if we can de-identify any of the information on there, whether all the identifiers on the information, such as date of birth or social security number, anything of that nature is necessary to have on the form. In addition to that, we sometimes do meet with patient groups to get their feedback. So there's a whole host of things that we do as well, but those are our core committees that meet on a regular basis that are related to HIPAA. Next slide, please. We also conduct a variety of audits throughout the year. One is what I refer to as a HIPAA rounding audit. These are audits that our compliance director and facility privacy officers go around to either physician practices or to hospitals or other types of healthcare facilities and go around, and I'll go through these in a second, and see if there's PHI laying around, see if people are familiar with HIPAA and privacy. So it's a way to do a less formal audit. We'd obviously publish these results, but it also allows us to educate and build awareness with staff that we're available. So it kind of serves a couple different purposes, and those we've found to be very helpful in at least bringing the message that we're watching them, we're trying to educate them, and they're done in a friendly manner. In addition to that, we also do HIPAA security audits. These tend to focus in more on security type of issues. Oftentimes we'll use an external vendor for these as well, because it's just from a resource standpoint. And these audits hone in on the EPHI issues more so than the rounding audits, obviously, because those are done by folks that don't have necessarily an IT background. In addition to that, we sometimes do EMR access audits. These can be triggered by an investigation, or they can be proactive if we're looking at various VIPs. We'll do those types of audits just to make sure that there is no inappropriate access. And then in addition to that, we have a software system called Fair Warning that runs various algorithms for us and patterns, and often we will review some of those if they warrant our attention. Next slide, please. This is just a sample of the HIPAA rounding audit questions. I'm not going to go through them, but I understand that these slides will be provided to you, and you can have it as background information if you find it helpful. But these are some of the questions and criteria that we go about when we're evaluating our facilities. Next slide, please. And this is just another, so just some more information about the HIPAA rounding audit. I just have a couple concluding remarks before I turn it over to Wendy. In addition to all of these items, we also have a compliance work plan. And with that work plan, we have a whole host of compliance initiatives, just not that are related to billing and coding or the anti-kickback statute in Stark, but we have a whole section on HIPAA as well. So with that, we'll look at things that could be anything from making sure that we have a process for people to get extra education if they're going to post things on our intranet site or our internet site. Or it could be something that we're going to review the storage of images on data copiers, because that was a issue that came out with an OCR settlement. Or it could be that we're going to verify that our volunteers received HIPAA training. So those are just some examples, but we have a whole host of other initiatives that are part of our annual work plan each year, and many of those relate to privacy and security, and we have a whole section on that usually related to them as well. So in addition to all these other things, we have some special projects like that, and with that, those are some of the steps that we've taken to kind of build a function that's related to privacy and security. We do work closely with the other departments. Certainly our IT department plays a very large role, risk management, legal, IT, and without working with our managers and our nurses and our physicians and all these other departments, it'd be very hard to be successful. So it's really, as I think Jerry said, it's just not the compliance department or the privacy officer's job to make sure there's no issues. It really has to be an organizational effort, and without getting every piece of the organization and every part of the organization involved, it's very difficult to not have any type of issues. And it's a very challenging environment. And these are steps that we've taken that we hope are helpful, but love to hear questions at the end as to what other folks are doing. And with that, I'll turn it over to Wendy.
Thank you, Greg. Greg, it was really interesting to hear what your organization is doing and to compare notes with what we are doing as well. It's amazing how much diversity we're in the actions that we're taking while we're all trying to respond to the same regulations. So it really is a wonderful thing to be able to talk to people, other people in the field, and to find out what other organizations are doing. One of the most important ways that we have found to reinforce a culture of privacy compliance is by having a clear system of discipline for privacy violations. Nothing communicates more the importance that a healthcare organization places on privacy. Plus, while not expressly required by HIPAA or HITECH or the privacy rules, OCR expects that organizations are really going to adopt a program for discipline and have a policy to that effect. So there are certain guidelines for violations that we strongly believe are important. The choice of the type and severity of the punishment must reasonably reflect, whether the employee was aware that the action that they took was not permitted. And so that highlights the importance of training and also having good, strong policies. Disciplinary policy should reflect the goals of the organization, whether it's to punish privacy violations, to deter them, to prevent them, or to reform the violators. And generally, the punishment should fit the crime. What sometimes can happen is that you find that the disciplinary actions are very severe, up to termination, even if it was just human error or system error. In addition, there should be some uniformity. Disciplinary policy should treat similar violations similarly, and violators should not be treated differently because of their role. What you find in some organizations is that nurses and frontline staff are treated much more strictly and severely than physicians. So that's something that you have to keep in mind. There's a lot, next slide please. There's a lot of variation between organizations as to sort of their disciplinary policy. In talking to my colleagues in other organizations, some tell me that they have a zero tolerance for privacy violations. Others will base their discipline determinations on the amount of patient harm and the severity of the patient harm and whether the patient is likely to sue or not. In my organization, we have taken a different philosophy, and we believe in something we call culture of responsibility, and some of you may have heard about this as being just culture, and it's based on the airline industry, and it is an attempt to try to get blame out of healthcare organizations. The idea is that what you want to do is to be able to address system errors And so you want people to report when there are issues so that you can deal with them, and that people are less likely to report when they make mistakes or when there are errors if they feel that they are going to be blamed for them. Next slide, please. Thus, the emphasis in our culture of responsibility is on behavioral choices and not the outcome or the harm that the violation created, because you can have something that is very minor but has very significant harm. For example, if there is a document that is faxed and it's faxed to the wrong number, it could be that that document is faxed to someone it shouldn't be faxed to, and it contains very sensitive information, and the patient has a lot of harm. The behavior actually is the same. It's just pushing the wrong number on the fax machine. So we try very hard not to look at the outcome, but rather to look at the behavior. When it is human error, we tend to console the employee, and we find that employees who are really trying to do the right thing can be very upset when they make mistakes, especially privacy mistakes. So we had one instance where an employee put the wrong letter in an envelope and was very upset. In addition, some mistakes they might seem at first that they were human error, and we find later that they were some kind of system error, such as the wrong fax number that was programmed in the fax machine. So for human error, we don't punish, we may coach, but we definitely console the employee. When it is at-risk behavior, we understand that sometimes there is some creep. There is, that sometimes employees will try to find ways to cut corners, and that those corners may place the organization at risk. For example, we've had employees who have looked at many emergency department patients, not because they were curious, but rather just to see what patients were likely to come to their department and to prepare for them. So that's a behavior that really is not correct, and the best way of dealing with that in our mind is that we try to re-educate them. And then, of course, there's reckless behavior, which is, for example, when an employee looks at her husband's ex-wife's records to see if there's any dirt, and we don't take any prisoners with that one. We terminate. That's the reckless behavior puts the organization at great risk, and we don't believe that we can bear the risk of trying to re-educate that person. If they do it with malice, then we terminate. But what we try to do is to also take a look at the circumstances and see whether there are any mitigating or exacerbating circumstances, so that we try to make sure that the punishment fits the crime. There are, next slide. There are live opportunities. There are times when it's unclear whether there's been a violation. Maybe the PHI it's unclear whether it is actually PHI. There are situations where it's a failure to follow policy, but not necessarily a violation of HIPAA. For example, if a person looks at their minor child's records, that is, they have the legal right to look at those records, but our policy is that we do not allow employees to look at those records electronically. And there may be difficulty in proving that the violation occurred or the identity of the violator. So, those are situations that we have to handle on a case-by-case basis. With non-employees who have access to our systems, if they violate, we terminate their access, because we don't have any kind of control over these employees, these non-employees, and what they do with our information. And access to our information is a privilege. And if you abuse that privilege, that's it. You get one infraction, and that's it. With physicians, we have to use our peer review process, but we have instilled in our medical staff the importance of privacy. So I think the main thing is that no matter what your philosophy of discipline is, you should apply it uniformly, and you should have some kind of policy or procedure that sets forth what that philosophy is, and how you discipline violations. Another area is that with regard to building a culture of compliance is that we work very hard at trying to define the scope of access to records. It can become very difficult to sometimes determine what the appropriate scope of access to records should be when it comes to treatment, payment, and healthcare operations, as well as other times when you disclose information. So we work very hard in trying to make sure that we are appropriately sizing the information that we provide. Next slide. One of the issues that comes up is who is a member of the treatment team, and not all members of medical staff are members of a treatment team, only those who are actively involved in taking care of the patient. And, you know, not people who think that a patient might need their services. It's people who are very actively involved in the care of the patient. And only the members of the treatment team are really entitled to get the information that they need to treat the patient. But they might not need all of the information going back to when the person was born. So we have to make sure that all members of the treatment team also understand that they need to consider how much information they need. Business associates often ask for, you know, all the information. Sometimes they don't ask and we provide it. So it's good practice to check back with business associates and with the corporate stakeholders to make sure that the information being provided is only the minimum necessary and is tailored to the function that they're doing for you. Decision makers and family, that as well can sometimes raise problems, you know, with recognizing who is entitled to what information. With research, we have had situations where researchers would like to get all the information that they might need for potential future research. They have to be limited to the information they need for the current research only. And education can provide problems. There is no exception for education. In HIPAA, it falls somewhat under healthcare operations, but we have to be really careful with the information that's being shared for educational purposes. Next slide. To build a culture of compliance, education is key and is required. Next slide. And these are what the standards are in the privacy rule about education. Next slide. In our training program, we provide training at many junctures. We have, you know, you do try to ping your employees as much as possible. So we have new hire orientation training, which for us is a general education on HIPAA requirements and the policies of the organization. We require also that all employees, before they get access to electronic health records, sign a confidentiality agreement, and we require that they re-sign electronically that confidentiality agreement every year. We provide an annual electronic training. That training is more targeted on the different types of employees and also on the major issues that we've encountered during the year. So it really is targeted to address specific issues. So for example, we had some employees who were using the medical record to look up the room number of their hospitalized coworkers. And we made it very clear that that was not permitted in our annual electronic training, amongst other topics, of course. Then we have spot training. When the department comes to us with a problem, we often will go and go out and do a face-to-face training with their staff about what the requirements are and to answer any questions. We also are working on having a regular training where we go around to all the different departments on a regular basis to make sure that we do some further face-to-face training and answer any questions they might have. And here I would also say that it's important, don't forget some of the sort of ancillary departments such as benefits, because they have very specific privacy concerns. And then we have remedial training, which is for re-education of violators, and we have a number of trainings that we're working on to address different issues that often come up with violations, so that we can provide additional education for employees who violate, but who we believe really didn't intend anything bad, and who we feel that could be re-educated. Physicians are a hard nut to crack because they have very specialized education needs and ways of learning. And it's important, I think, that we all too frequently address physicians in privacy training. As a general rule, we have found that it's best if physicians are trained in person, if the lessons are fairly brief, if possible, if they can get CME, continuing medical education credit for it, and if it highlights in anecdotes common physician issues and uses physician characters. If you have a situation where somebody is you're trying to train that you shouldn't inappropriately access medical records, if the characters are nurses or techs, the physicians are likely to think it doesn't apply to them. The other thing is to try to start early. So we provide training to residents during new resident orientation and to medical students as well. So, try and get the physicians very early. And as Greg highlighted, it's really, next slide, privacy is really a team sport. And what you want to make sure of is that the employees know their responsibility, their privacy responsibilities. They know how to get their privacy questions answered, and that they report to the privacy office, if possible, any possible privacy violations, even if they're unsubstantiated. And how do you do this? You make sure that the privacy office is visible, easy to reach, accessible, and you realize that you can't do privacy by yourself. It really is a team sport. It requires the involvement of HR, of IT security, of senior leadership, of medical records department, social work, public safety. The list goes on and on. All of these people take a very important role in helping you to investigate privacy violations, take action with regard to privacy violations, instruct employees of what their responsibilities are, so it really is. You're only as effective as the team, and the team really consists of everyone. Next slide.
Okay, for those of you who are attending this webinar and would like to apply for CLE credits, please note that the CLE verification code for this session is 2014-073. Again, that's 2014-073. Just make sure you write it on your attendance sheets and send it back to us, and we will be eligible for CLE credits. Okay, just want to see if there are any questions. I did not see any from the Q&A or the chat box. I'm not sure.
Yeah, well, I had a couple that came through, Michael, so if you'd allow me. Go ahead. And just because we had a couple of questions about this, we will be sending copies of the presentation to everyone who attended after the presentation, and so hopefully those will be useful to you. And Michael, that is actually a video that includes the audio portion. Is that true?
That is correct.
Okay, great. So hopefully that'll be useful, and we encourage you, if you found this was helpful, to share it with your colleagues as appropriate. Anyway, a couple of questions came through. One which really follows on what Wendy was talking about, and I guess I'd put it then to Greg, is how are you engaging physicians in privacy and security compliance? Greg, you might be on mute.
Oh, sure. I wasn't sure if you were asking for Wendy or myself.
Yeah, no, please, Greg. Since Wendy just addressed it, I thought it'd be interesting to hear what you folks are doing.
Yeah, I mean, we try to not really treat physicians differently than our employees. So when we roll out our training, everybody generally receives the same type of training. Now, when there's communications that we send out to our physicians, it's sent out through our chief medical officer, because we feel that has a little bit more weight, and that they'll pay attention a little bit more to the emails. So when we, for example, if we were concerned about a physician storing something on a cloud where we don't have a BA agreement, we send an announcement out, one to our regular work staff and then a separate one to our physicians. So we do provide some specialized training to for physicians, but we try to create training that we think would be useful for all work staff.
Yeah, I always find in giving advice on this to remind people of the physician in Southern California who actually went to jail. Usually gets a physician's attention. Egregious behavior, but nevertheless, I think the only person that I know of who actually got jail time for a HIPAA violation. So Wendy, what do you do when in a disciplinary situation you have the manager involved in it who disagrees with the recommendation from your office?
That's a really tough situation for us, because we're viewed as a support department, and the manager really is the one who controls the discipline that is imposed. Usually they follow our recommendations. Occasionally they don't, and what that says to us is that we need to do some more education with that unit and with that manager. And usually after we sit down and discuss with the manager and really get them to understand what we're recommending and why, they do come around.
Okay, well, that's interesting. Is that something you sometimes have to escalate within the organization just to make sure that you've got consistent policies?
Absolutely. Absolutely.
Okay.
And HR has been a really great team player for us. They work with us very closely when they do investigations. We basically give them the information, and for the most part, then they go and meet with the manager and with the employee and investigate the matter. And then they are the ones who convey our recommendation based on what they find out. If the manager does not accept that, then we will have a meeting with them directly to discuss it, and we'll provide a lot of education. With regard to one department, I think we went and we had something like 4 or 5 educational sessions with every employee in that department about privacy, highlighting the specific infraction that occurred, so that we made it clear that they would know exactly what they can and can't do. Very often, when the manager is not agreeing with the discipline that's recommended, it is because they feel that the employee perhaps did not know that they shouldn't engage in whatever action they engaged in, such as, that they shouldn't have looked at the record. And so they sometimes will push back on us because they would say that we need to perhaps do a better job of educating the employees so that they know, what is and what isn't. And in those cases, that's fine with us. We go out and we do the education.
So that kind of leads to another question that came through is how do you select topics for training, ongoing training? We've heard from Wendy on this a bit. Greg, do you have any thoughts how you fashion the training content?
Sure. It's a couple factors that drive our content each year. The first factor is that we look at all of the possible breaches and non-breaches and types of issues that occurred throughout the year. And the issues that come up most often, we'll usually try to create a video or two or three on those topics so that employees get some fresh training on the topics that are really cause the issues or more real issues in the organization. And we try to make it interesting and sometimes add humor to it. Sometimes they're more serious. Sometimes they're very humorous. So last year we had a talking laptop that went to jail. So that's one of the approaches that we take. The other thing is that when there is a new technology such as clouds or even a new OCR settlement, and we try to take a good look at that and then do training on that. Obviously, phishing emails and education on that went out after the recent large breach from a large health system recently. So we try to use a balance of those two factors in kind of driving our content. And then the third thing is obviously when you give training, you got to cover everything, or you want to try to cover everything so employees don't forget about HIPAA, which is a very broad topic. So it can be challenging trying to balance that, but those are the things that we try to incorporate.
Yeah, and this is for both of you. I mean, kind of how do you balance online versus in-person training? Obviously online has the capacity of reaching a broader audience, but it oftentimes doesn't have the participants' full attention during the training unless it's really carefully prepared. Kind of how have you viewed those alternatives?
Sure. In my organization, I don't have much of a choice because we have approximately 48,000 employees, so online is the only really viable way to get the training done, and we're really vigilant about getting 100% compliance. So we do it that way, and I do agree that online training is not always as exciting, but last year I starred in one of the videos, and we had the talking laptop, so we really try to add humor and make it interesting. We use real, like CBS video clips and other types of things throughout our training. So that's kind of how we go about doing that. Obviously, we give live training for remedial training and things of that nature, but we just don't have the resources. I don't think any large organization does to give live training to that many employees.
And with Christiana, we've got 10,000 employees, and so it really, we have to do, our annual training has to be electronic, and the way that we've tried to do it is to include games on there, and now we're starting to use video clips. It sounds like, Greg, you're doing that already with the video clips. We find that is much more engaging. We don't really believe, that, some organizations sort of feel that with privacy, all that's important is just to show that somebody actually took the training, so you sort of check that off. I did the annual training. It sounds like Greg as well. We're really trying to make a point. We're really trying to get people to be educated and to build a culture of privacy compliance. So we really do try to engage the employees in the training as much as we can. So this year we, for example, had the whole beginning of our training was different employees who had different roles and different jobs talking about why they felt that privacy was very important to them and in their job. so that people can see, that their colleagues are also, really care about this issue and are in the training. But obviously, the electronic training, we try really hard, and I think that, but you can't stop some people from just clicking through, and it's really the in-person training that really can get the point across, I think, more effectively. So as much as time allows, we try to get ourselves out there and to train different groups of employees and answer questions, because it's amazing how many questions there are, and very specific questions that people have regarding privacy in their specific role that just cannot be addressed in a electronic platform.
Indeed. And Tom, as a follow-up question to your remarks just asked, what action do you take against employees who don't complete required training or provide the attestations?
Well,
or Wendy, either. Go ahead.
Oh, okay. I'm sorry. For us, if you don't, we have something which is an incentive program, and if you don't complete the training, then you are not eligible to get a bonus. So that's really a good incentive to get people to take the training. What I would like and what I'm working toward is the possibility that we might say, if you don't sign the electronic confidentiality agreement, you don't get access to our network. But that has been a hard sell.
Yeah, I hear you. Greg, any different approach?
I like the incentive approach that Wendy, we take a little bit of a different approach, and there's varying degrees. Each year sometimes shifts around, but in the past we've suspended parking privileges. We've made it so they can accrue vacation time, and even up to suspension or termination. So it varies. Usually we never get to the point of termination, but usually we have progressive steps, and there are disciplinary measures that are addressed at each stage.
So on both sides you pay serious attention to that. Well, that's great. Well, we're up at our hour, and this is Jerry Hinckley on behalf of Pillsbury. I want to thank both Greg and Wendy for their great participation both today and the enjoyable time we've had in preparing for this presentation. Again, watch your inbox for a copy of the presentation, and please let us know if we can assist you in any respect with respect to CLE credit. And with that, I will say goodbye and hope to do another one of these very soon. This was really fun. Thanks a lot.